Again, welcome to Introduction to Health Informatics, HA135 course. This lectures will cover chapter 3 of our course textbook, and the topic is healthcare settings. So our main objective is to list and also define hospital categories and identify different types of hospital patients. We're also going to differentiate among freestanding, hospital-based, and hospital-owned ambulatory care centers. Also, we're going to distinguish among various types of behavioral healthcare facilities. Also, detailed services provided by home care and hospice agencies. Also, we're going to explain various types of care and also describe federal, state, and local healthcare facilities. So first, we start with the acute care facilities. And here we said acute care facilities are hospitals that provide healthcare services to patients who have a serious, sudden, or acute illnesses or injuries, and or who need certain surgeries. So ACFs provide a full range of healthcare services, including ancillary services, emergency, critical care, surgery, labor and delivery, and so on. So, and ancillary services are diagnostic and also therapeutic services provided to inpatients and also outpatients. And this can be a laboratory, physical therapy, etc. Most hospitals' inpatient stays are short, normally less than 30 days. Although some patients may stay for a longer period of time if it is medically necessary. Now, because each inpatient day is very expensive, a utilization of case manager closely monitors patient care to determine whether acute healthcare service is needed. So acute care facilities, we have different types. First is the single hospitals. A single hospitals normally is a hospital that is self-contained and it's not part of any larger organizations. And there's not much branches around the country. But single hospitals can have a satellite center, which is a distance or an office in different location, but again, it's part of the single hospital, it's part of the hospital. So again, single hospitals are hospitals that is a self-contained and it's not part of any big organization. A multi-hospital system can be 2 or more hospitals owned, managed, or leased by a single organization. And this can be in the form of a corporate setting. This may include an acute, long-term, pediatric, rehabilitation, and or psychiatric care facilities. And ancillary services are diagnostic and therapeutic. Also, we have the acute care or short-term care. We also have a long-term care. So hospital bed count or bed size normally is the total number of inpatient beds for which a facility is licensed by the state. So we may have hospital, may have 100 bed size or 200. It depends on the license. And hospital categories, here we have a critical access hospitals, which represents CAH. These are normally hospitals that are located more than 35 miles from any other hospital or another CAH. So must be at least 35 miles away from any hospital. Or they are state certified as being a necessary provider or healthcare to area residents. The marriage criteria is reduced to 15 miles in areas where only secondary roads are available or in a mountainous terrain. So CAH must provide emergency services 24 hours a day, and also must maintain no more than 15 inpatient beds, except for swing bed facilities, which can have up to 25 inpatient beds if no more than 15 are used at any one time for acute care. So inpatients are restricted to 96-hour stays, unless, again, it's possible that a longer period is required due to weather situation or the development of another emergency condition in the community. We also have general hospitals. Normally, general hospitals provide emergency care, perform general surgery, admit patients for a range of problems, from fractures to heart disease, based on the licensing by the state. And we may have a specialty hospital that concentrates on a particular population of patients. For example, we have a pediatric hospitals which concentrate on children of a specific age, or it can be a disease category, let's say a cancer hospital. We also have a rehabilitation hospitals. So a rehabilitation hospital may admit patients who are diagnosed with trauma. Example can be a car accident or a disease. Example can be a stroke, that they need, again, rehabilitation and need to learn how to function. We also have a behavioral healthcare hospitals. These are specialized in treating individuals with mental health diagnosis. Also, physicians who spend most of their time in hospital setting admitting patients to inpatient services from local primary care providers are called hospitalists. I'll call again us. One of the main objectives of this lecture is, again, trying to introduce and define a new terminology in healthcare profession or health informatics profession. And hospital patients can be outpatients, which is ambulatory patients. These patients are not allowed to stay overnight in the hospital. So normally these patients are allowed to receive a care in one day without the need for inpatient hospitalization. Care is provided in either a freestanding or hospital-based facility. We may have a day surgery. So these patients may have a surgery during the day and they may not stay in the hospital for overnight. And these are called the ambulatory surgery patients. We may have emergency care patients that normally receive treatments or emergency treatment in the hospital emergency department. Inpatients are patients that are admitted in the hospital for more than at least a day. And newborn patients are babies. It can be babies that are born in hospital, or they were born in another facility but brought to the hospital for maybe a special treatment, and they are still babies, sometimes even less than 24 hours or less than a week. We also have observation patients. These are patients that may need admission, but physicians are not 100% sure of their condition, whether they will be discharged or they should say. So this patient can be observed for some reason. So observation is a special service or status that allows physicians to place a patient in an acute care setting within the hospital, but for a limited amount of time to determine the need for inpatient admission. Hospital patients, we have, again, a subacute care patients. And subacute care patients are medically fragile and require special services, such as inhalation therapy. Maybe they may need some device or instrument, intravenous tube feeding, which means they need a device to be fed, or complex wound management care. The ambulatory and outpatient care, we have again a freestanding, which we normally call the ambulatory surgical center. These are centers that, again, a patient can get a surgery for a day and don't have to stay in the hospital. We also have an hospital-based outpatient department. Most hospitals may have an outpatient clinic department where the patient may visit a doctor for treatment or consulting. They would not stay in the hospital just for a day visit and count. We also have hospital-based emergency department where patients who need emergency care, mostly patients get involved in accident or maybe had a heart attack or some other very urgent care. Hospital-based ambulatory surgery program also is available. We have hospital-based partial hospitalization program and also public health department. And then satellite clinic. Satellite clinic will be part of the hospital, but the location is not in the hospital, maybe some distance away from the hospital. It can even be a different city or different town. We also have urgent care centers. And normally urgent care centers provide easy access to quality health care for times when our primary care physicians' offices are closed. We may have hospital-based physician practice, hospital-owned satellite clinic, which is again a clinic that is distance away from the hospital, but is part of the hospital. Industrial health clinic. We may have a neighborhood health clinic. This normally provide a community with a medical or community health. Physician's office can be a private practice, practitioner, a medical doctor have his own office. We also have alternate care facilities such as behavioral health care facilities. Normally these facilities are for mental illness or mental care. And also we have home care and hospice. These are for aging population that need more assistance in their everyday life activities. We may also have a long-term care facilities for, again, patients that have need a long-term care for a specific injury or disease that may, again, last for long. Now, with the behavioral healthcare settings, we may have, again, this must be under a special licensing by the state healthcare center dealing with, again, mental health or psychiatric services, but must get a license from the state. And this can be ranges from healthcare settings that are least restrictive. A least restrictive example can be outpatient weekly psychotherapy, to most restrictive, which can be year-long residential treatment. A residential treatment is more or less like inpatient admission process. This can include different types of healthcare settings. We have the example one is chemical dependency program. The facility can provide 24-hour medically directed evaluation and withdrawal management in an acute care inpatient setting. Treatment services usually include detox or detoxification, withdrawal management, alcohol detox or heroin, cocaine, etc. Also, we have the crisis services. Crisis services normally will provide short-term, usually fewer than 15 days crisis intervention treatment. And patient may receive 24-hour-a-day supervision. The crisis can be any crisis that can cause a trauma to a patient or a person that may lead to unstableness of the patient. So that we are mental health facility or behavioral health care settings. We also have a day treatment program for behavioral health care settings. This will be an intensive treatment program provided to patients who live in the community but come to the facility up to 5 days per week. And also developmental, disabled, mentally retarded facilities. These facilities may offer special services to, again, patients who are mentally retarded. There may be some devices, specialists that, again, will take care of them. Also, we have emergency care facilities in the behavioral health care settings also. We have a family support services and home health care also. And there's hospital treatment. Also, there's intensive care case management. There's also outpatient clinic in behavioral health care settings, where patients, again, comes for treatment consulting for a day without staying, living in the facility. Or it can be a partially hospitalization program, and also residential treatment facility. In this case, patient will stay in the resident or in the facility and get the full care. We also have a respite care. Normally, respite care will provide a short-term relief. That's the main difference with residential treatment facility. Respite normally is a short-term relief for primary caregivers. It can be arranged for just an afternoon or for several days or a week. Care can be provided at home, in a healthcare facility, as an admission, or at an adult care center. We also have the therapeutic group home. These programs normally provide an alternative living environment and mental health care treatment services in a licensed, non-secured facilities for children and adolescents with, again, significant emotional or behavioral problems who have some capability to engage in community-based activities. Next is the home care. So home care normally allows people who are seriously ill or dying or very, very old to remain at home and receive treatment from nurses, social workers, therapists, and other licensed healthcare professionals who provide a skilled care in the home. So the skilled care services can include assessment, monitoring of illnesses, if it's IV is needed, intravenous and medication administration, also insertion of catheters, tube feedings, wound care. The home care, again, also cover the usage of durable medical equipment. Durable medical equipment can include crutches or canes or IV supplies, hospital beds. These beds can be a special bed for patients, can be bring to the home of the patient. Or if oxygen also is needed, or any medical supply will be provided. We also have the home infusion care. So home infusion care is also provided by home health care agencies when intravenous administration of medication is medically appropriate for the patient's condition. Also, if the treatment is administered in the home instead of hospital facilities or medical facilities. So example would be infusion therapy. This include chemotherapy. So this chemotherapy will be provided at home instead of a medical facility. So intravenous administration of chemical agents that have a specific and toxic effect upon disease-causing cell or organism. Also, we have drug therapy, intravenous administration of other drugs, including antibiotics, antivirus, and so on. Hydration therapy, which can be intravenous administration of fluids or electrolytes and other additives. Pain management can be intravenous administration of narcotics and other drugs designed to relieve pain. Then we have total parenteral nutrition, TPN. This is administration of nutrition substances by peripheral or central intravenous infusion to patients who are either already malnutrition or have potential for developing malnutrition. And we also have the Hospice Care that provide comprehensive medical and supportive social, emotional, and spiritual care. So these are, again, different types of home infusion care. And hospice care normally provide comprehensive medical, supportive social, emotional, and spiritual care to terminally ill patients and their families. And the goal of hospice is palliative care. And the main goal of palliative care is the comfort management rather than curing or curative care. Therapeutic main goal is to cure some disease or injury. But hospice normally for comfort management. Most patients in hospice care have a terminal illness, which means the illness cannot be cured, and most are very old. So the main goal is managing their everyday life activities and to make it more comfortable. So most hospice care is provided in the patient's home. We also have a long-term care, which can include nursing, social, and rehabilitative services for people who need ongoing assistance. Normally, these services are used by aging population. So the length of stay typically average greater than 30 days, some even for the rest of their life. While most residents of long-term care facilities are elderly, but young people also need long-term care during an extended illness or an injury that's caused by accidents and they cannot function. So long-term care facility provide a range of services, including custodial, intermediate, rehabilitative, and skilled nursing care. So long-term care include a range of nursing, social, and, as we said, rehabilitative service for people who need ongoing assistance. This can be adult daycare type, assisted living facilities, continuum care retirement communities, or intermediate care facilities, long-term hospitals, residential care facilities, and skilled nursing facilities. Also, the federal and the state and local health care, here we mention 4 categories. Correctional facilities also provide a lot of medical services to prisoners, people who are castrated. The military health system also provide medical and health delivery services to military personnel. We also have the VA, or the Veteran Health Administration, VHA. They also provide medical facility to veterans. Then we have US Public Health Services. So let's go through each one. So a correctional facility normally is a primary health care that is provided by physicians, nurses, dentists, and other staff at clinic. But these clinics are located in a prison facility. So they have a chronic disease management, dental care, vision care, health screening, emergency care are provided on site within the prison facility or correctional facility. Inpatient acute care is also provided at local hospitals with medical, surgical, long-term, and psychiatric care provided by specialists at outpatient clinic located within a secure area of the hospital. This can be the general public hospital or hospital for average populations, but this facility may have a secure place where prisoners or people in the correction facility, if the medical assistance they need is not in the prison site or the prison hospital or clinic, then they can be transferred to a general public hospital or private hospital for treatment, but must be secure. Most of the time, again, these patients will be assisted with prison guards or police officers to guide them. Also, within the military health system, almost every military base have a general hospital, at least one general hospital. Then within the military base, they have what we call the MTF, that's a military treatment facility. These are normally small clinic in the military base. So military base, depends on the size, may have more than one clinic, which again called the MTF. This is where if the military personnel have slight problems, maybe pains, not serious emergency medical problem or health issue, they may go to the clinic. And they also have a dental service, dentist clinic, etc. Dental clinic. So military health system administers health care for active members of the uniformed services and also their dependents. So the military family members who are not military, they are not in the military, but they are military dependents, also get treatment in military facilities. Again, we mentioned the MTF is a clinic or hospital located in the US military base. It can be in US or overseas where there's a military base. So that will be the end of these lectures. Again, in these lectures, we discuss mostly about healthcare services and also facilities in US. We talk about different types of hospitals, clinic, nursing homes, also in prison, correctional facility, in the military, etc. So again, wish everybody the best, and we will see in chapter 4 of our course textbook lecture. Thank you. Again, if you have a question, you can send an email or you can call me on my phone that is provided in the syllabus. Thank you.